Hi, good evening po sa inyong lahat. To all our viewers, to all our subscribers, good evening to all of you. This is Dr. Mike and welcome to my YouTube channel. And kumusta po ang inyong Sunday? Kumusta po? Tignan lang natin kung nagla-live na tayo sa ating YouTube. And sa lahat po ng ating mga viewers, sa lahat po ng mga nakasubaybay sa atin, magandang gabi po sa inyong lahat. It's a Sunday. Sana po naging mabuti, naging maganda ang inyong Sunday because yung pong ibang umuulan, maulan po sa labas. And ingat-ingat po dahil po tumataas pa rin po yung kaso natin dito sa Hong Kong in terms of the pandemic. Mag-ingat po tayong lahat. Kumusta? Kumusta po ang buhay natin ngayong Sunday? Kumusta po ang naging day off po natin? Ayan, may mga live chatters tayo ngayong gabi. To all our viewers po, Lenny, magandang gabi po. Ann, good evening. And then the rest nanonood po ngayong gabi. It's another interesting topic ang discussion natin ngayong gabi because some of us, sometimes we eat different kinds of food. Sometimes the food that we eat nagmamanifest po. Nagkakaroon tayo ng tinatawag na halitosis or bad breath. Minsan po, may nakakatabi tayo or minsan meron tayong nakakasabay sa MTR or sa bus na kung saan meron pong not so good in terms of the oral hygiene. But paano po kaya nakukuha yon? Paano po natin nakukuha yung tinatawag na bad breath? Or kung meron kang bad breath, naaamoy mo ba ang sarili mo? Kasi minsan yung ibang tao ang nakakaamoy and then you yourself, you don't know, di ba? So, yun po yung nangyayari sa atin. And then, ayan, dumami po yung mga nanonood sa atin. Si Dr. Carlo nanonood din. Si Miss Pia nanonood. Si Miss May, hi Miss May, Lori. Si Honey, si Jeff. Hi Jeff Vicencio for watching also. Ang ating pong guest ngayon, tonight's guest, we have a 12-hour difference. In his place, it's 9:30 in the morning. In Hong Kong or in the Philippines, it's 9:30 in the evening. Okay? And our guest for tonight, let me introduce our guest. He's a good friend of mine. He's a dentist by profession. He has his master's in India. And then I met him in Hong Kong U, in one of the residential halls at Hong Kong U. He had his PhD in dentistry, and currently he's on his residency training in endodontics. Probably we could ask him later at the University of Buffalo in the US, in New York. So without any further ado, please welcome our guest for tonight, Dr. Sharas Govindool. Hi there.
Hi, how are you?
I'm good. How about you? It's
Doing
been
fine.
how many years so far?
It's been a year and a half, I guess, since we met last.
It's been a bit long, right? And then how's life there?
It's good. We have good winters, real winters.
Were you
And
able to adjust already in terms of the weather? Because you're used with the weather in Hong Kong or
Hong
probably in
Kong was more hot and humid. Here it's more cold and moist with snow.
okay. So right now, in terms of the climate, is it cold in New York?
It's raining right now. It's
It's
raining.
raining. Oh, it's also raining here. So probably there might be some snow in your
Snow
place.
soon. We'll soon have snow by around October. We should be having snow, October, November.
Oh, and then yeah, we have so many friends now watching. Okay,
I
some of our
saw.
students, some of our friends, Gian, Hani, Dr. Carlos watching the Hong Squad, all your fans before. So
Hi,
perhaps some of
Carlos.
our students, yeah, some of our students in the past, they still recognize you because I remember you gave a talk previously.
Yes.
Yes, right. Mm-mm. So, what you miss most about Hong Kong now that you are living in the US?
The people of Hong Kong.
So you miss them.
Here in Buffalo, it's a little lonely. People are a little sparse, and there's not much of activities that we can do here as in Hong Kong.
Mhm.
And the university life is a little different as compared to Hong Kong U, especially
Uh,
the residential halls. I
uh,
miss new college like anything.
yeah. How about in terms of food? Do you miss? Or your food is basically the same.
It's I can manage because I cook well.
Yeah, you
So
cook. And you cook really good. The Indian food that you always cook what do you call it? Is it the
Trying to,
biryani rice? The biryani rice, and then
yeah,
the
yes,
yeah. You always give me. I miss that food when we were staying in the hall. But
absolutely.
anyway, by the way, how's your family? How's
Family
your
is back in India, back in
Hmm,
India. She is working in a dental school, and
okay,
right now she's on COVID duty. She is taking care of COVID patients.
okay.
So she is away from home for a month
Yeah,
when
because
she's doing so.
in terms of the adjustment, in terms of it's a long distance. Long,
It's a long distance relationship, but
yeah.
we're managing.
In few years, you're done with your program there, but
A year from now, a
yeah,
year
and
from
then
now, I'll be back.
you're planning to stay in the US, right?
Yes, I'm planning to stay in the US.
Okay, so all the best in your endeavors. Yeah, but anyway, I invited you. Thank you for saying yes to our program
Please,
for
it's always a pleasure.
out. Okay, so I appreciate that so much. But
Thank you.
anyway, our topic for tonight, because most of our overseas Filipino workers or our workers, um, they have experienced some degree of halitosis or what we call bad breath. So in general terms about oral hygiene. Uh, as a dentist, how would you further explain or define this concept of oral hygiene and how is it important? Is it really important to have a good oral hygiene? Yeah.
Yes, for sure, it's in yes. We should understand this that mouth is a place where we are placing the food in. So it's a port of entry to all the nutrition that we are going to be having, and we expect it to go down into our body with as much as nutrition and cleanliness as possible.
Mm-mm,
So oral hygiene in the form of brushing your teeth, rinsing your mouth after every meal, and keeping your oral hygiene well will definitely promote good health.
mm-mm,
Second thing is the teeth are grinding for you for life. Three
mm-mm,
times a day at least, you're going to be chewing on something to eat. So
mm-mm,
you got to take care of your teeth.
mm-mm.
So it's not something that you can say, okay, God gave me something, I'm not going to take care of it.
Uh,
It's a grinder for you. It's a grinder for life.
so we
So
need
my first, yes, you need to take care of your oral hygiene in the best possible way. And a strong suggestion would be to replace your toothbrush every month and
everything
every
like a
month,
month, every
every month, every
not
month.
3 months or every month.
3 months was back then when they were making toothbrushes in a good way.
Okay,
Now the toothbrushes don't last that long.
okay.
And there are specific toothbrushes that I would recommend that you should look for toothbrushes with very thin bristles.
Thin bristle. Okay.
Thin bristles. These are known as, I don't want to name the companies, but yes, for the viewers, I have no choice. Colgate Slim Soft is one of them. So this has 17% less, the size of the bristle is only 17% of the actual brush. So
Mhm.
what happens is it goes into very fine crevices and cleans better.
Okay.
And when they brush, I just want to stress that they're not supposed to use any force, and the bristles have to be straight. They should not fold. If they
Okay.
fold like this, then they don't brush well. So they
Okay.
have to use light, gentle forces to make sure that the bristles are straight. Only
Mhm.
then they'll be able to brush properly.
Okay. So I just want to repeat that one for our viewers. So in order for you to, in terms of the brush, you need to find a brush with a fine, thin bristle. Okay. And then you need to change your toothbrush every month, right? And then how about for specific toothpaste? Do we have specific toothpaste we need to use?
Toothpaste is only to make you feel good about your brushing, but actual cleaning process only happens with your toothbrushing.
Okay.
Yes, the toothpaste which have fluoride are an additive. It
Mm-mm.
helps in fluoridation of your mouth and your teeth. But per se, even without a toothpaste, you can definitely brush your teeth well with warm water, and it should take care of your oral hygiene.
Oral hygiene. Is it advisable? Okay, don't put so much force in brushing your teeth. Because nowadays, when I went to the market, it's not only the bristle kind of brush, right? Because we have the sonicator, the one
Yeah.
that the battery operated. Is it also advisable to use that one?
Well, the battery operated toothbrushes initially came out for people with Parkinsonism or who are mentally challenged, who cannot do good oral hygiene, or for healthcare providers who were doing the brushing to ease their work.
Okay.
Yes, I don't say it is not needed, but it is it gives you a false sense of cleaning your teeth.
Mm-mm.
But if you are having one, make sure you use it well. And again, the same rules apply. Please change the head of the electric toothbrush every month,
Mm-mm.
and don't use it too much because you are not doing any work. So you're relaxed or you feel nice that it's going around on doing its own work. Don't overuse it. Make sure you use it only for a minute or two,
Mm-mm.
not beyond that.
Mm-mm.
And use gentle forces because these are nylon bristles and they can abrade your teeth and
Okay.
your gums.
Okay.
Especially with the electric toothbrush, you have to be careful because it is spinning at a high speed.
Mm-mm.
So it will damage your teeth and gums much faster than what you would do with your hand. So please use it very diligently when you're using it.
So probably later we could expand our discussion towards the prevention and the proper way of brushing or
Sure.
flossing or the use of mouthwash. My question is, in terms of halitosis or good oral hygiene, what is the common symptoms that patients would experience to have a good oral hygiene? Is it one would be probably bad breath or halitosis? So how do we acquire to have a bad breath or halitosis?
Halitosis is nothing but bad breath.
Mhm.
So this comes from a Latin word, hiatus, which is air, and otis is air. So
Mhm.
what happens is in this scenario that there are bacteria in the mouth,
Mhm.
and these bacteria break down the products that we eat or we consume, and that causes the bad breath.
Mhm.
If the bacteria were left alone with only saliva, they will not be able to cause that much of a bad breath as much as when we leave some food inside the mouth or we don't brush and keep a good oral hygiene. So if you look at the overall population being affected by halitosis, it's about 85% which are affected because of oral origin.
Mhm.
So in halitosis, we have three kinds. One is oral origin, that is which is caused by something that is happening in the mouth. Non-oral origin, that is something that is happening from maybe your other body functions, your
Mhm.
stomach, your kidney issues, your liver issues. And we do have some other cases such as dietary concerns. So
Mhm.
these are the broad three classifications that I would say that cause halitosis. And if you look at the oral causes, the main cause would be the tongue coatings. So
Okay.
there is a, yeah, we do have something that coats the tongue every time we don't brush or keep our oral hygiene, or every time we eat. I'm
Mhm.
sure when we have some coffee or tea, you can feel that there is some coating on the um, um,
Mhm.
tongue.
Mhm.
So this coating causes about 43% of halitosis.
Mhm.
These are percentages given for specific populations. So I didn't quite find a study from Hong Kong, but I did find studies from all over the world. So about 40 to 43% is what I would say is caused by tongue coatings.
Mhm.
So the most effective way of tackling this would be scraping your tongue with a tongue scraper and making
Okay.
sure your tongue is clean.
Mhm.
So that is one thing. Yes, please.
Because most of the time, people or the people I know is only they brush their teeth. Right?
Yes.
They don't even brush their tongue, or they don't even use a scraper tongue because I asked my friends about this. Some of them, they thought, what is a tongue scraper? They haven't seen any tongue scraper or some brush. If you
Have
turn
tongue scrapers at the back.
at the
You're
back.
right.
But some of our friends, probably our viewers watching tonight, they don't know what's the function of the other side of the brush because some brushes they have that tongue scraper. So so it's important as well to brush our teeth, not just the teeth but also the tongue.
I would not say use the brush for the tongue because once you brush the
Mm.
tongue with your brush, the bacteria go into the brush. So
Oh,
which is not good. So I would always want to use a scraper as a separate
separate one.
instrument
Mm-mm.
rather than use the brush to brush your tongue.
Oh. So ayan po ha mga kababayan, dapat you have a brush, toothbrush, and also yung pang-scrape ng tongue. Don't use your brush to brush your tongue because the bacteria would just go to your toothbrush. Okay, I think that's a very informative lesson for all the viewers tonight. So do you have specific time on how many seconds or minutes should we brush our teeth and also our scrape our tongue?
So on an average, 2 minutes is the recommended time period that is required to brush all the surfaces of your teeth. So you do have the buccal surfaces, you have the anterior region, you have the inside of your teeth. So
Mm-mm.
people tend to only brush the outside, but you should remember the insides also need to be clean. And the best way of cleaning is, if this is your tooth, you need to brush from bottom up. And for the upper tooth, you need to brush from up down.
Down like this, like
Yes, it should be away from the gums, because
okay.
if you're brushing towards the gum, you're damaging the gums.
Oh,
So
mm-mm.
you should always brush away from the gum. So
Oh,
that way you're preserving the gum and you're removing the bacteria from away from the gums. If you're brushing it towards the gums, you're pushing the gums bacteria into the
yeah.
gums.
Mm-mm.
So that causes problems to the gum.
Oh, I think that's a good information because when I was young, some of my friends would always tell me when you brush your teeth, you need to use force, okay, up and down motion. So you just push your gum and the bacteria inside the gums. So I guess mga kababayan po dapat palabas. Hindi po towards the gum pag nagbo-brush tayo. Okay, and even inside the
Inside, you do it this way.
okay.
Do it from inside, and here you can bring it like this. So the toothbrush, I'm sorry, I don't have a toothbrush, but you can bring it from, go in, place it against the two gums and tooth, and then pull it out. So
Okay.
that way you're cleaning both the things.
And then how many times do you have any recommendation on how many times we need to brush our teeth?
2 times is reasonable. 2 times is reasonable.
Okay.
And it must be 2 times for sure, because in the morning you don't want to go to your work with bad breath.
Yeah.
And when you're sleeping, what happens is there is a reduction in your saliva production. That is, you don't salivate as much as you would when you're during the day. So if you leave the bacteria and food in the mouth, you will wake up to a bad halitosis. So if you brush your teeth and rinse your mouth with warm salt water, something that I strongly recommend to everyone, instead of using mouth rinses, this will help you wake up with a fresher breath. So when you brush, you're again improving the condition. Rather than taking it from very bad to bad, you're taking it from bad to good. That's how I would put it.
Oh, so at least we are teaching our viewers now brushing is important. Another one, the proper way of brushing, okay, is important so that we will not upgrade the gums and also use a tongue scraper, okay, so that to remove the bacteria. Do not use your brush to brush your tongue because it would just the bacteria will just go around your oral cavity or your mouth. In terms of using mouthwash, because nowadays we have this alcohol containing mouthwash or sometimes the non-alcohol containing. What can you say about this kind of mouthwash?
Well, to be honest with you, I don't strongly recommend mouthwashes for a
Okay.
simple reason. It
Uh-huh.
contains chemicals.
Oh,
Whether it's alcoholic or non-alcoholic, both contain chemicals which are unnecessary for the
it's
mouth.
yeah.
But yes, when you're going for some parties or when you're having someone, I mean, dating someone or you have some close encounters in a meeting, yeah, you may have to use a mouthwash. And if you are doing, I would strongly suggest that you use a non-alcoholic mouthwash.
Non-alcoholic mouthwash.
Yes, because alcoholic mouthwashes, what it does is it dries your mouth and
Yeah.
causes more halitosis.
Mm.
So for that moment, you will feel really fresh. But within a few span of few minutes, say 15, 20 minutes, your mouth feels dry and your halitosis comes back.
Mm.
So a non-alcoholic mouthwash is better.
Mm.
And chlorhexidine mouthwashes have been shown to be of better results.
Okay.
But long-term use of chlorhexidine has also been shown to cause staining of the tooth. So you have brownish discolorations of the tooth.
Mm.
So I would not strongly recommend to use of oral mouthwashes unless it has been prescribed for some gum diseases.
How about those using baking soda?
Yeah, the homemade,
It's
yeah,
very common. Yeah. Uh,
homemade remedies are really good sometimes.
mm.
Baking soda is perfect. 2 spoons of it in one cup of warm water with a few drops of maybe peppermint oil or something is perfect.
Can you
But
do this every week or what? Every day? What
every
would
night before they sleep,
the night before sleep? Okay,
yeah,
baking soda. Okay,
I would
and then
suggest.
okay. How about flossing?
Flossing is a very good cleaning technique for between the teeth.
Mm-mm,
But the truth is, if it is not done properly, it can cause more harm than good.
mm-mm,
So I'm sure the viewers will know how to use YouTube, and I would like recommend them to watch YouTube videos on how to floss
mm-mm,
correctly, the
mm-mm.
right way, properly. So
Oh,
what happens with the floss is between the teeth when you push the floss,
mm-mm.
it's a nylon thread that is going in between.
Okay.
So it is cutting through the tissue if you are not careful.
Oh,
Please use waxed flosses. Don't use unwaxed ones.
okay.
So
It should be
use
fast.
waxed. It should be waxed. So when it is waxed, what happens is it lubricates itself as it goes down the teeth and it
Mm-mm,
does not cause any damage to the tooth.
mm-mm,
So please use waxed ones and use the finest possible floss. Don't
mm-mm.
use the thick floss. Don't think the
Last time
thicker the better.
I used the thick one, and it's really,
No,
and I had the bleeding gums after.
yes,
Yeah.
yes. I would suggest a thin one. See, the basic process of flossing is you're taking down the
Yeah.
floss,
Mm-mm.
pressing it against the tooth and pulling it out. So
Out.
it is not the sawing motion that you should be
So I was
doing.
going to
You
wrong.
should, that
Okay.
is why I was saying it's a very nice technique, but if it is not followed properly, it can cause problem to your gums.
Mm-mm.
So you should never use it in a sawing motion. You should only use it in a push and pull motion.
Mm-mm. Okay. And now, going back to halitosis or bad breath, now we have discussed some of the other things, the causes of this one. And then you mentioned about the different, it might
Not
be
what it
oral
was.
origin or in the GIT problem. What other things that our viewers should know about bad breath? Mm.
See, digestive problems cause about 3% of the
Mm-mm.
oral halitosis, and it could be because of indigestion. The food
Digest.
is not indigestion because of probably food poisoning, or they have eaten something that they are not able to digest, or maybe sometimes they have eaten beans which are not being able, beans.
Okay.
The beans sometimes are not digested by some people. They have this alpha galactomyosome enzyme that is lacking in their digestive system, so they may have a bad breath.
Mm.
But and oral regurgitation. So what happens is sometimes they do have this heartburn. So when this happens, that also can cause a little bit of halitosis.
Mm.
Other than that, what I would see is ulcerations in the esophagus sometimes does cause.
Yes. Mm.
You have to be careful. You should not misdiagnose yourself. If you feel that you have halitosis for a long time and you don't see any oral conditions, I would strongly suggest that you please go to a dentist and first evaluate your oral hygiene and then go to a general physician to make sure that all the other things are ruled out. Because under the non oral causes that cause halitosis, we
Mm.
could have GI causes, we could have metabolic disorders such as diabetes, we could have liver disorders, we could have kidney disorders. So these are all serious complications which have to be noted initially to have a better treatment.
Yeah, I asked this question because some of our viewers might be thinking that, oh, I brush my teeth regularly. Oh, I eat the right kind of food. Oh, I scrape my tongue. I use the tongue scraper or I use mouthwash. I floss. But still, I could smell, or some people still smell something about
Yes.
my breath. Mm-mm.
Mike, what happens is it is not only these non-oral causes or oral causes that could cause halitosis. There are other causes, like if you are having dental caries or if you're smoking.
Mm-mm.
So smoking is a strong cause for oral halitosis because it alters the temperature of your mouth and it alters the chemical structure in the mouth. So
Mm-mm.
some bacteria which cause the smell could increase. And per se, the cigarettes itself or tobacco itself has its own inherent smell.
Uh-uh.
So for 2 hours, you should be having the smell of the smoker, but
Mm-mm.
after 2 hours, it neutralizes and becomes the same as with any other non-smoker.
Oh.
You also have halitosis due to menstruation during menstrual cycles and periods. There are females who complain of halitosis. This could be because of the blood that is broken down inside the uterus, which is reabsorbed by the blood, the byproducts, and this is coming out of the lungs as halitosis.
We'll
So
see.
this is one of the cause.
Okay.
It could be because of sinusitis.
Okay.
sinusitis can cause, and postnasal drip. So the postnasal drip can be loaded with bacteria and which can cause bad breath. Other causes could be alcohol, which is again causing dry mouth, medications. Some oral medications which patients are taking could cause dryness of mouth. And antihypertensive drugs cause swelling of gums.
Mm-mm.
That is, we have gingival overgrowths, because of which halitosis does come. It's a big problem with people who take antihypertensive drugs, especially with slightly elderly patients who are under stress. Stress is also a major contributor, because when you're stressed, your mouth goes dry.
Oh, yeah, viewers, remember if you're stressed, again, the oral cavity becomes dry, and if it's dry, it can lead also to halitosis or bad.
Halitosis.
Mm-mm.
So these are all the conditions that cause halitosis, Mike, overall.
Oh, I think our viewers are they've learned so many things from you. And then if uh, these are the factors, these are the causes of halitosis, how about those with false teeth? Sometimes, how do they need to take care of their oral cavity because they have false teeth or dentures? Mm.
Dentures. So
Yeah.
we in false teeth we have two kinds. One is the fixed type of dentures which are fixed into the thing. So that they have to make sure that they use a special kind of brush which goes under the bridge and cleans it. And for dentures, we have denture cleansing tablets, which every night the patient has to remove his denture, brush it just as he brushes his teeth or her teeth, and place this with the denture tablet in a container of clean water,
In water. Okay.
clean cold water, not hot water, clean cold water. And a tablet is put into this. This tablet actually, what it does is it disinfects the denture. The denture is not a solid material, it does have some amount of pores into which bacteria can go and sit.
Mm-mm.
And for the edentulous gums, what the patient has to do is take a clean piece of cloth, wet it with warm water, and just run it around all the gums and clean the palate and massage the palate. So what
Mm-mm.
happens when you wear a denture, the gums are compressed or the palate is compressed. So the tissues are under compression. So they don't produce enough saliva.
Okay.
So when we remove the denture, it relaxes the gums or the tissues. And when you massage it, the blood circulation comes back to this tissue. And that is when the salivation is good. So when they wake up in the morning, they have a good breath and the denture is clean and they can just rinse it with water and then place it back into their mouth.
Mm. Okay. And then if, for example, they would go to a dentist, and after hearing this, for sure, some of our viewers might be interested. Oh, I need to go to the dentist so that to check. They might be afraid. Some of our viewers might be afraid. What would the doctor do if to diagnose that I really have some problem in my oral cavity? What are the things that we usually do at the clinic?
In the clinic. Okay, when the patient's chief complaint is halitosis, when they come to the clinic, our oral screening procedures are, it's straightforward. What we do first is evaluate if the patient has any gum problems or gum issues or periodontal problems, what we call. The technical term would be gingivitis.
Mhm.
And then we also look for caries in the teeth. And we look at the general overall oral hygiene index. So overall oral hygiene index is where we assess all these factors in one as a holistic approach. And we then advise the patient to get the things done in three segments. One is the emergency care, then we have the restorative care, and then we have the maintenance care. So
Mhm.
what we do in the first phase is that we just clean the teeth and make sure that all the emergency procedures are attended to. And in the second phase, we are restoring, where we are doing more definitive treatments of filling the caries, doing deep scaling. And in the final maintenance phase, every 6 months, we ask the patient to come back for evaluation and just general checkups
Mhm.
and maybe dental cleaning.
Mm. And then you mentioned about the dental cleaning or dental prophylaxis, right? And then for some viewers who would be interested in oral cleaning or the dental prophylaxis, how many times should they need to do this one in a year?
In a year, on average, 2 times a year is good enough.
Two times
But
a
it
year.
also depends on the patient's individual habits.
Mm-mm.
Like if they're chewing betel nut or if they're having some other habits. Uh,
Mm-mm.
Maybe we will have to evaluate per individual, and then maybe we'll say, okay, you have to come back every 3 months or 4 months. And some patients have a tendency of forming a calculus. Calculus is nothing but the hardened form of plaque. Plaque is the biofilm that forms on the teeth. So some patients do have this tendency of getting this plaque, which calcifies and becomes calculus.
Mm-mm.
So such patients, we would definitely want to see them much more often,
Okay.
just to make sure that this calculus does not cause gingival problems, which in turn will cause halitosis.
Yeah, because there are times that some patients, even if they brush so much, even if they use so many things, there are some the yellowish discoloration or plaque build up, right? And it would be very difficult for them to remove this one by the ordinary brushing. So they need to
Yeah.
go to dentist so that they would remove this one, right?
Yes.
Mm.
Yes.
In terms of the lifestyle and some home remedies for the benefit of our viewers watching tonight, what is the advice that we could give in terms of home remedies? Because some of them probably some patient maybe you don't want to go to the dentist, but we advise you to go to the dentist, or sometimes because you know that going to the dentist it would entail a lot of money. It's kind of expensive, particularly in Hong Kong. Let's face it. They want to do it when they go back to their home country, which is much affordable. What advice can we give them, like lifestyle or home remedies that they could do?
First and foremost, brushing your teeth twice a day, flossing at least weekly once. I'm sure every day is difficult for the domestic workers because they're under huge work stress. So weekly once, when they have their day off, when they have time for themselves, they should take time to floss,
Mhm.
standing in front of the mirror and after watching videos that guide them into how to properly floss, and cleaning their tongue every day and every night. Then other remedies I would say is they can eat good food.
Mhm.
And the truth is that if you have onion or garlic in your food,
Yeah.
it is unfortunate, but it's the smell stays for 6 hours because the food
Ah,
that you eat goes
okay.
into the stomach. The volatile substances, the volatile sulfur compounds that are there within the garlic and the onion come into the blood, and then they are excreted either as sweat or
Mhm.
either as bad breath. So either way, you have to reduce your consumption, especially of raw onion and raw garlic.
Mhm.
And definitely a strict no-no
Mhm.
if you don't want your halitosis.
Mhm.
Reading about this, I had a funny anecdote that was told to me by one of my professors, that French butlers or butlers in the general, they don't eat any onion or any garlic
Mhm. Mhm.
because they don't want to have halitosis, or they don't want to have a body odor when they are with their masters.
Mhm.
So this is the truth that they totally avoid garlic and onion.
Yeah, because most of the Filipinos watching now, garlic and onion is part in whatever cooking or preparation of food that they're
I
having.
understand.
Sometimes
I
garlic is good for the heart, so sometimes they eat raw garlic. So it's an advice for the viewers tonight that these two, the compounds, the volatile substances, you could smell after, and it would stay for 6 hours.
six
That's
hours, 6 hours up to
oh,
until
okay.
when it can be excreted.
Okay.
Avoid tobacco
Mhm.
products,
Mhm.
any form causes halitosis for sure. Alcohol to a large extent, but yes, if you have alcohol in moderation and you keep yourself hydrated, you
Mhm.
can have alcohol. But what happens with people is they don't tend to drink water after drinking alcohol, so they get dehydrated. So definitely I would say hydrate yourself well. When you're having some alcohol, you could have some cucumber, carrots that make you salivate better to prevent bad breath. Chewing on parsley is a very good mouth freshener. Parsley is a very good antioxidant, so it prevents halitosis. You could have pineapple juice,
Mhm.
which also is good for your digestion. So once your digestion improves, you will not have any of these problems.
I
And it
think
also
our
keeps
viewers would be drinking pineapple juice tomorrow.
fresh pineapple juice, not the bottled
That
pineapple juice.
should be fresh. Fresh.
Yes,
Okay.
because
Yeah.
all the antioxidants are lost in the process of processing the food. And a lot of water is something that I would strongly suggest. And as you had mentioned before, yogurt or probiotics is a very good option.
Okay.
A cup of yogurt, maybe in the morning or in the night or in the afternoon, whenever it is possible. It's a very good way of keeping your oral health in a good thing. Orange juice, and some patients have deficiencies of zinc
Zinc.
and zinc. So this element of zinc has a strong implication in oral health. So
Mhm,
your gingivitis, your gum problems and issues, even hair problems start with lack of zinc and magnesium.
mhm.
So if they are able to afford some sort of a supplement, multivitamin supplement with zinc and magnesium, is a
Uh-huh.
good option. It's a good option for general oral health, or
Mhm.
they can consume good food with which has more of zinc and magnesium. Green tea for sure, and I'm sure all of them are having a lot of green tea, but without sugar.
Without
Green
sugar.
tea with yeah, without sugar.
Mhm. Uh-uh.
So apples is a good form of it's since it's crisp and it has got pectin, a chemical which enhances the breath and the crispness of the apple, the texture cleanses the teeth as you eat. That is
Mhm.
why the saying goes, eat an apple a day, keep the doctor away. So
Hey, yeah.
this is the reason why they say this, because
Uh,
when you bite on an apple, it is actually cleaning your teeth as you bite into it.
okay.
So because of the crispness,
Mm.
the texture is cleansing your teeth very well, and the chemicals in the apple are a good antioxidant and as well as good for your oral health.
Yeah, I think and it's
Other
eating apple is healthy, right? So it's not
yeah,
just
for
in
sure.
your mouth and having a fresh bread,
Generally,
also good for the health. Mhm.
yeah,
Of
for
course.
sure, for sure.
Yeah, yeah, yeah. And with all of this, nowadays most people are wearing masks. In Hong Kong, if you go out, all of these people,
Well, even in New York, we do wear masks now.
and
It's been
most of the
mandatory.
yeah, most of the complaint of this of our workers or people is, can you tell if you have a bad breath by breathing into your hands, right? So nowadays, because of wearing masks, they could smell their breath either in the morning, in the afternoon, or in the evening. And then since you mentioned the different food, I think we could advise our viewers watching to eat these different kinds of food so that freshens breath. But what can you say about those wearing masks? Because it might lead to other problems, like for example, halitosis, or you need to hydrate still.
Yeah, the problem with mask is when you wear a mask, you tend not to have anything to eat
Mm,
or tend not to drink anything.
mm,
So it's like a barrier. So what happens is you hydrate yourself less.
mm,
So
mm,
I would strongly suggest that they keep themselves well hydrated, and especially in this COVID situation. People are tending to be a little more stressed about their jobs or being inside, cooped up, quarantined, or being inside the houses. So please keep yourselves hydrated and keep your stress levels low by doing something that you like. That is one strong thing that I would say. And with regard to trying to cup your hands on your face and trying to, it's not possible for a simple reason. There is something called as olfactory fatigue. That is, you tend not to smell your own perfume once you wear it.
mm,
Probably when you're spraying it, you smell it, but within a few minutes, you stop smelling it because your olfactory senses
mm,
become numb to that. So just like that, your halitosis smell may not be felt by you, but would be felt by someone else. So it's very gross to ask this, but then you can ask a friend or someone to tell you if you're having a bad breath
yeah.
and then take remedial actions.
Yes.
Or you can go to a professional, and they do have tests where they assess the amount of volatile sulfur compounds that are present in your mouth, or they do gas chromatography, which are higher level of tests,
Mm,
which are also very expensive also. But these tests clearly indicate your level of problem, and they give you a proper remedial solutions for these. But the main thing, Mike, is that all our viewers should understand they
mm.
have to make sure that their oral hygiene is good, and if they still have halitosis, should visit or consult a general physician to rule out any other problems, because this could be diabetes, this could be kidney problems or liver problems. So they have to get a holistic test done to make
Mm,
sure that they don't end up with something bigger.
bigger. Yes, I
Because
think
this is an indicator, this is an indicator of some problem. So we should respect it, and we should understand that it is trying to tell us something, the body is trying to tell us something, and we should take remedial actions for it.
Yeah, I think to all our viewers, clear po na naintindihan po ninyo na ang halitosis po minsan hindi na po nanggagaling sa oral. Minsan kahit anong brush natin, anong gamit natin, meron pong pinanggagalingan na iba. So instead of visiting, aside from visiting a dentist, kailangan po rin yung mag-visit ng mga general physician po para mas matignan po kayo. Baka po ang pinanggagalingan niya ay diabetes or ibang klaseng sakit na nagagaling sa tummy natin, sa stomach natin at lumalabas yung hininga natin na hindi maganda po yung amoy. Okay? And this is the most exciting part now. So we will go to our chat box. I would try to check some of the questions from our viewers. We have so many viewers and they told me it's very informative lecture. But again, to all our viewers, please like, share, and subscribe for our YouTube para po sa mga susunod na videos natin. So the first question would be this one. Is halitosis contagious? If she would kiss or he would kiss someone, can he acquire or can she acquire bad breath? Okay.
Well, with someone with halitosis, I doubt if anyone will want to kiss them, first of all.
What if a partner?
No, it is not contagious. It is definitely not contagious. But yeah, if you ask me on a serious note, if you are having halitosis, there is an underlying condition. So you have to be aware that you have to be careful about it. It should not be, I don't think it is contagious per se as an infectious disease. So nothing to worry. If your partner is okay with your halitosis, you can go ahead and kiss.
Okay, and we'd like to greet our super chatter, si Hazel John Adventure. Good evening sa'yo, Hazel John. Next question. Oh, it is a comment. Every month that we need to change our brush. According to her, she always change her toothbrush, every 5 months. Now, she's aware that every month, we just need to clarify. So every month, they need to change their brush with a thin bristle, right?
Yes.
Okay. Do you recommend any specific brand? Because I don't know.
Colgate Slim Soft is something that I have found very useful, or otherwise any other brand with ultra soft bristles. We have something called ultra soft bristles. I would strongly recommend ultra soft bristles. Anything with ultra soft bristles.
And another comment that she used her brush to brush her tongue. So again, it's not a
strict no. It's a strict no. In fact, one of the studies that I read suggests that we use two separate brushes, one for the morning and one for the night, because the bacteria that are there in the brush after you brush takes 24 hours to die. And you have to make sure your brushes are not in the washroom. They have to be in a place where it can dry itself. It should be dry when you're using it next time. If it is moist, it is already growing bacteria and you're introducing the bacteria again into your mouth. So it is strongly advised that the brush be perfectly dry when you're keeping it, so that when you next time use it, it should be absolutely dry. This is something that people don't know.
Yes, actually, this is very important because most of the toothbrush, they are inside the washroom, inside the bath.
So what happens inside the washroom? It's humid. It's warm, so it breeds bacteria on your toothbrush.
The bacteria can grow in the brush. Okay.
Yes.
Another question is this one: does bad breath run in the family?
No, it is not genetically transmitted.
Okay.
Unless if it is a diabetes thing or something which is more genetically related, or I should say it's a co-founding factor. I don't think it's halitosis does not have any predilection for genetics. It's been research has proved that it's not genetically caused.
Not genetic, it is not hereditary, hindi ko nahahawa, hindi familiar yung ako sa family. And how about those brush with black bristle? Nowadays, it's common to have the black bristle brush, like an indicator brush, something like that.
Exactly. Yeah. So what the companies are now doing is, the consumers are not changing their brushes quite often. So they are staining the bristles with a certain color. It could be blue, it could be black or anything. And when the color fades, so you know when it's time to change the brush, it's a good indicator. It's a good indicator. It's a good way of letting the person know that this brush needs a change.
How about the use of toothpaste with salt? Because there's a question here. Is it okay to use salt as a toothpaste?
Well, salt is an abrasive, so you have to be careful when you use salt as a powder, I mean, as a crystal. So it causes a lot of abrasion. So what I would suggest is use salt in a solution, and you can probably brush with a strong solution of salt. It should take care. But
Mm-mm.
never use salt directly on your teeth. They are going to cause a lot of abrasion. It's like an abrasive powder it's worse than any toothpaste or tooth powders.
Okay, so
So never use salt
don't
directly.
use salt mga kababayan, baka magagasgasan po lalo ang mga ngipin natin. Maaaring magasgasan din ang gums natin dyan. Okay? Another one is poor diet can cause bad breath.
Yeah, patients who are on diets, this is something I forgot to tell. But, the moment they go on a diet, the body goes into a ketogenic phase. So once they're on a ketogenic phase, what happens is the ketone breath or the apple smell that comes in the breath sometimes is pleasant, sometimes it's not pleasant based on what is there in the oral cavity. So yeah, dieting does cause a lot of bad breath. But with this, what I would say is if they're hydrating themselves really well, the amount of bad breath will come down, and they can use fresh parsley, or they can chew on carrots or apple to prevent this bad breath from happening.
Mm-mm.
Something that I would add on to this is chewing gums, mint,
Mm-mm.
or mouth sprays and rinses. All of these are temporary measures.
Mm-mm.
The
Temporary.
underlying cause has to be first met with, and only then they will think. But yeah, if you're meeting someone, probably you can have a mint just to keep the conversation going for a few minutes. But after 15-20 minutes, once the mint is worn off, you will start having halitosis again.
Yeah. How about, because there's a question here about the flossing. Because there are some floss with a toothpick-like kind of floss. So what can you say about that?
My personal opinion would be not to use plastic toothpicks or
Okay.
plastic ends of the flossers, for
Process
a
na.
simple reason: plastic is very hard on the tooth and gums.
Mm-mm.
Wooden toothpicks are much better because they soften when they come in touch with the saliva. They soften, so they don't cause much damage. But on a large scale, on a overall look, if you ask me, using a toothpick very often is bad because you are damaging your gums. You're poking your gum again and again, and it will cause damage on a long term.
Mm-mm. Yeah. And then we have another super chatter with Miss Moshi. Thank you so much, Miss Moshi, mga laging nakasubaybay sa atin. Another question, when you have the artificial or dentures, what is the best way to clean? And is it before the viewer would go in bed? What is the
Yes.
best? Yeah. Mm-mm.
Once they remove the denture, they have to gently brush the inner surface, the surface that goes onto the into the mouth, as well as the outer surface. With If they want to use a toothpaste, they can. But if they don't want to use a toothpaste, they can just brush it gently, because more abrasively, if they brush it, the denture loses its configuration, and then they have to soak it in either cold water with some baking soda, or
Mhm.
maybe a little bit of salt. There are denture cleansing tablets, which is the most recommended thing because this has effervescence. So when I say of effervescence, it's bubbling that happens. The bubbles destroy the bacteria on the denture. So they have to clean it before they put it into the water.
Okay.
And they have to clean the denture cup in the
Oh,
morning. When they remove the denture, clean the denture and put it into their mouth. They have to clean the denture box and keep it to dry.
keep it to dry.
If they leave the water in, or if they keep it wet, the
Mm-mm.
bacteria is going to grow there.
Mm-mm.
And then when they put their denture back, the bacteria is going to come back on the denture. So
Oh.
always make sure you dry the thing well and keep it dry, so that in the night when you go back, you refill it with cold water and put your denture into it with your chemical.
Yeah, and then this would be might be the last question, and I think the question is how to get rid of stone bad breath. Is it because of the tonsils and the cure, or take it away from the throat? So how is this one?
Well, yeah, this is something, it's a very, very good question. I forgot, with sinusitis, we do have something called tonsils, which also cause bad breath. When the tonsils are infected, we do have bad breath. Per se, removal of tonsil is known as tonsillectomy, but it's unless it is really bad, I would not recommend to remove the tonsils because, as you know, Dr. Mike, that tonsils is the first line of defense for anything that is going inside us. It helps in preventing infections.
Mhm.
And I would not suggest a tonsillectomy just for bad breath.
Okay, yeah, because some people might be thinking that should I remove my
Mm.
tonsils so that bad breath. So,
Unless it's really bad and it's getting reinfected very often, I would not suggest. What I would suggest is to gargle with warm salt water to make sure your tonsils are taken care of, because the tonsils are taking care of your other health problems.
mm,
It's taking care of your general health. So you don't want to compromise on your general health just for halitosis.
mm. And then lastly, what advice can you give to our viewers watching tonight? Because I think this would be enlightening for them, the proper way. Because in my case, the take-home message for this discussion is all about the proper way of brushing, the proper way on how many times should we use our toothbrush, the proper way on how to clean the tongue, and then the possible use of mouthwash if in case, or the flossing, and then the proper kind of food that we need to eat in order for us to freshen the breath, and also the food that we need to avoid so that we would not be having this bad breath. And if in case that all of this fails and still patients still have this halitosis or bad breath, they need to go to a physician where general physician, that there might be an underlying cause beside the oral problem. It might be within the tummy, like diabetes, like any other problems that may lead to bad breath. So, what advice, Dr. Sharas, that you can give to
So,
all our viewers probably watching this tonight? Mm.
as a summary, what I would say is please brush your teeth twice a day, floss at least weekly once to make sure that the oral hygiene is taken care of. Make sure you clean your tongue. And when you brush, make sure you don't do a horizontal brushing because this is abrasive. It should be rolling and it should be gentle.
Mm.
And with regard to mouthwashes, chlorhexidine mouthwashes, non-alcoholic chlorhexidine mouthwashes are the best
Mm.
to use. But remember, when you use mouthwash for a long time, especially the chlorhexidine mouthwashes, you can have staining of teeth, which is brownish discoloration of the teeth. So beware of that. You can rinse your mouth with warm salt water. When I say warm salt water, it's 1 cup of water with at least 2 spoons of table salt, which is well dissolved. And make sure that you rinse for at least 2 minutes vigorously, spit it out, and don't use any cold water after that. Go to bed with this after this mouthwash is done. You will definitely see a change within a few weeks because you cannot expect that it changes within a day. It's a
Yeah.
problem. So you need to make sure that you change it. You see the change in a few weeks. All
Mm.
right.
Mm. So with that, thank you so much. I know you will still go to work after this live stream. Do you want to greet your friends? Do you greet your family? Anyone that you want to greet?
To all my viewers, please stay safe. It's COVID time. I know it's a very stressful situation that we are all in. We'll all get out of this sooner or later. May God be with you all. That's all I can say. And to my family, thanks to them. I'm here doing my residency. Thanks, Mike, for
Thank you.
helping me out.
Yeah, thank
Thanks,
you
Mike,
so
to
much. Hope
inviting
this,
me.
yeah, I hope this would not be the last. Every time that I would message you, I would call you, you will always say yes to me. I hope that we could meet one day. And to all
Absolutely.
our viewers, maraming salamat po sa ating super chatter, si Hazel John, si Moshi, maraming salamat. And to our new friends, si Eva Mapa and Bernie Nunez. At sa mga friends ko kanina na na-meet ko, maraming salamat po, and I hope to see you all again. Sa mga viewers natin ngayong gabi, don't forget po to like, to share, and subscribe po sa ating channel so that next video, ma-notify po kayo. So with that, Dr. Sharas, thank you so much. And Dr. Carlo
Hi,
was watching also tonight
hi,
because,
Carlo.
yeah, he's your avid fan. He wants to be like you one day. So,
He will be beyond me. Trust me on that.
okay, so magandang gabi po sa inyong lahat. This is Dr. Mike. Be safe, be healthy, and be nice to everyone. So have a great day, Dr. Sharas. Good morning to you on the other side of the world. And magandang gabi po sa lahat po ng viewers natin from Philippines, Hong Kong, at different parts po ng mundo. Have a great night, everyone, and thank you so much.
Good night, Mike. Thank you
Good
so much.
night. Yeah, bye-bye.
Bye bye.